Hi,
You're Steve.
my name is Steve, and I've come to see Dr. Tong because a recurring problem that I'm concerned about. I've had a certain type of cancer, it's kind of rare, called Leiomyosarcoma for the last 30 years. And I've had 3 operations with it, one 30 years ago, and then it returned 18 years ago, then 1 year later again, 19 years later after the first one. And now my doctor has found 2 small nodules again with the CT scan last year. My surgeon, my other doctor, doesn't want to operate because it's very conservative. He said it's in a bad place, I don't want to do it. But he thinks it may be growing. And one of them was there 5 years ago. But now it seems to be growing about 1.5 centimeters, one of them is. And I'm here to seek alternative treatment. Why? Because I want to find out the causes. What is the cause of this cancer? There must be a fundamental bottom line cause to it. And Dr. Tong asked me, do you have any stress in your life? So I told him, no, I don't have a lot of stress, but then I do have some stress, because obviously I must have, because I'm getting angry too fast, lose my temper too fast, I'm too short with my wife, and anything she says irritates me. And something needs to change within me. And so I'm here looking for some inner causes, the bottom line causes. Why do I have a short temper? Why do I have this disease? Why am I holding on to it? And I'm looking for bottom line causes. I've been a psychotherapist for 13 years, had my own office, so I've been into bottom original causes in treating my patients and my clients. That's always been my approach, to treat the origin of a cause, not just the symptoms. So far, I've had some symptom treatments with my doctors, basically surgeries. But I'm looking for something else, not just treating the symptom, this condition, but what is the bottom line cause, and to neutralize the cancer, and also what's making me upset. One of the symptoms that Dr. Tong tells me I need to take a look at it, and I haven't been paying a lot of attention to it till lately, is that I have this lower back pain right above the sacrum. Not my muscles, but my back bones just hurt. And it hurts even when I haven't done any hard physical work. I haven't stressed myself the day before, days before. But in the morning I wake up with it. It's a bit tight now. But at times, like 2-3 days, I just may wake up with it. It's going to hurt me for half a day before it goes away. And it comes back the next day and goes away for 2-3 days, and it recurs for no reason that I can assign to it at all. So I'm here to seek causes for that too. And so far, I'm encouraged, because Dr. Tong tells me that it has to do with the circulation of the ki or chi energy in my body. And I want to find out why is it restricted, and why is it causing all these symptoms with me.
Prostate problem?
Oh, another one is, thanks for reminding us, a prostate problem, libido problem, and
Hemorrhoid?
Hemorrhoid, it's another one. And all seem to be indicative of too hot an internal environment, according to Chinese Oriental medicine. So I want to find out how to change that.
What's the symptom of the prostate?
The prostate, one of the prostate enlargement symptoms, I have to urinate very often. I'm a teacher, and I have to go between each period. I have to rush to the bathroom because I just can't wait to go. And I can't hold it for 2 hours. Yeah, I just had my first treatment. It's just finished about 3 minutes ago, 4 minutes ago. And the first thing I noticed is my back is a lot more relaxed. There's a tension there I didn't even realize. And it's a lot more relaxed. And as a matter of fact, it's pretty relaxed. And the next one is really noticeable is my breathing. It's just naturally deeper. It used to be shallow and short, And now it's a lot deeper. I can't believe it. It's like increased.
See, I told you were smiling.
Tremendously. I mean, we're not talking about doubling. It's like tripling or quadrupling. And it's unbelievable how the breathing is increased.
Do you feel angry?
It tells you a lot of oxygen is going to where it needs to go.
Do you feel angry?
Oh yeah, not angry. I was angry even this morning, frustrated, on the freeway, and just angry.
Not think about
my wife tells me, "You're angry again. You're angry again." You know, the slightest things irritate me. So
how about now?
It's all like gone into the wind. It's like a fog. It's just kind of wafted away. It's gone.
Tell about your vaccine program.
Oh yeah, and another thing that I didn't mention previously, that I've been in the vaccine program for about 5 years for cancer. It's supposed to be a preventative vaccine treatment, and included a lot of injections in the lymph nodes, under the arms, in the groin, for about 5 years. First every 2 weeks for several months, then once every 3 weeks, then once a month, and just tapered off. But it lasted for about 5 years, periodically, with constant blood tests to see if the antibodies were building up. But this cancer has returned again in spite of it. So I'm looking forward for his cancer to shrink and to go away, frankly, because the original cause, I'm looking for it to be treated at Dr. Tong's.
Do you feel healthier now?
Oh, a lot. I feel it, and I'm hoping that it's not just a feeling, but it's my feeling is a symptom of an actual underlying changes that are coming about.
So you feel healthier, right?
Which, as a psychotherapist, I'm always looking for.
So do you feel healthier now?
I feel it, definitely. My breathing is the main indicator, and of course the tightness in my back is gone. So, yeah, I've been suffering with a numbness in my little finger and this part of my hand since I was about 11 years old, when I broke my elbow and the bones were set wrong and pinching a nerve. After about 10 minutes holding my arm in any position except hanging off the bed, it would get numb and start hurting, and I would have to shake it out. And in the morning, if I woke up, because I've been sleeping on it, it would hurt like crazy, because it's been in one position for several hours. And now my arm has been in this position on my chest for 10 minutes at least, and I can feel a little bit of numbness, but it's not as acute. I've been having my hand on my chest here for at least 10 minutes in one position, and this is typical a position where my little finger would go completely numb and start hurting because of pinched nerve in my right elbow. That has been there since I was age 11, and now it's well past 10 minutes and I can feel my little finger pretty good, and there is no numbness in it. There's sort of a hint of it in there, but if I could put a number on it, it's probably 1/10 or 1/20th of what it used to be, and it just started coming back about the last minute or so. It wasn't there at all before that. So I know this treatment is working, and I know subsequent treatments is going to go away if this trend continues, because so far it's been working pretty good. I mean, I can move it without it being numb, and not just numb. It used to be really, really painful after a while.
And what you do when you do that in the past? What happened?
And the only way for me to get rid of this numbness and the associated pain with it is I would have to shake it out like this. I would shake it out, and I would let my arm hang over the bed or wherever I was sitting over the side of the chair to get the feeling to come back, for then the pain to go away. And it would go away, but as soon as I picked up anything, and I would hold a book or start riding even, because riding even would hold my arm in one position for a prolonged time. It would get numb, and there's nothing I could do about it except stop whatever I was doing, let my arm hang, and to make that pain go away. And this seems to be really, really helping. I'm really encouraged by it.